Alright, today in this video we're going to be talking about Wiggers diagram. So what is Wiggers diagram? And it is what you see right here. And what it is it's a time-based representation of various aspects that make up cardiac physiology. Specifically, it integrates depolarization, contraction, with pressure and volume changes in the heart. So we can see that this diagram has all of these different colored lines, and those lines are showing aortic pressure, atrial pressure, ventricular pressure, and ventricular volume. And then down here we have a line that represents our EKG. So this is where our depolarization or our tracking of electrical signal comes in. So what's really cool about learning and understanding Wiggers diagram is you begin to really be able to visualize heart function. I'm sure everyone is familiar with GIFs, the short little animated videos. Well, with Wiggers, it's almost like you start to see a GIF of the heart in your mind, and you're able to see exactly what is happening every time your heart beats. So all around, really, really cool stuff. And with that being said, let's go ahead and get right into it and dive into integrating all of these moving parts together. So, Wiggers diagram starts with the firing of the SA node. We know that the SA node spontaneously depolarizes, and then that depolarization travels from cardiac myocyte to cardiac myocyte through intercalated disc. So that causes the atriums all across the atrium to become depolarized. We have atrial depolarization, and that can be reflected right here on our P wave on this green line, which represents our electrocardiogram. So shortly after atrial depolarization, we know that the goal of atrial depolarization is to try and get contraction. And we talked about in a previous video, the reason for this is because when we depolarize cardiac myocytes, part of that depolarization is we get a little bit of an influx of calcium into the cell. And if that calcium travels to the sarcomere of the cell, we can start to see contraction occurring. So shortly after our atriums depolarize, we start to get atrial contraction. And we can see that represented here on Wiggers diagram through this little rise on this yellow line here, which represents our atrial pressure. Because when we start to squeeze and contract the atriums, we're getting smaller and smaller and smaller, which means our pressure is going to be rising. We can also see that atrial contraction is occurring through the increase right here on this little purple line, which represents our ventricular volume. So this is because when we squeeze our atriums, the blood in our atriums is now going to be pushed and forced into our ventricles. So our ventricular volume is going to go up here. Now, at this point, atrial depolarization is going to complete, and that electrical signal is going to hit the AV node. The AV node we know has something called AV nodal delay, and we can see that represented right here on this little straight part of our EKG line. And what AV nodal delay is there for is to allow for that last little bit of contraction to occur so the ventricles can finish filling. And we can see that right here through that last little bit of atrial pressure rising right there, and that last little rise in ventricular volume. Now, once atrial contraction is completely complete, our mitral valve closes. So now nothing more can come from the atriums into the ventricles because that valve is closed. From there, the AV node sends that electrical signal or depolarization to the bundle of His, down the right and left bundle branches, and then to the Purkinje fibers, which depolarizes our ventricles. And we can see all of this reflected in our QRS complex right here on our EKG line. Shortly after ventricular depolarization, we start to get ventricular contraction. And we can see that ventricular contraction is occurring through this increase in ventricular pressure here. We are squeezing down on our ventricles with that contraction. We can also see that this ventricular contraction is occurring through this slight bump up on our atrial pressure line. And the reason for that is we know that our ventricles have a bottom to top contraction because the aorta that we're trying to push the blood up into is above the ventricles, so we have to squeeze up. Well, when we are squeezing up, we also know that the atria sit above the ventricles, so that pressure of squeezing up is going to push up into the atriums, causing this little bump up on atrial pressure. Now, once our ventricular contraction is enough to build up ventricular pressure enough to beat our afterload, which is the back pressure on the aorta, what's going to happen is our aortic valve is going to open. Now, we know that our aortic valve is open at this point because we start to see a decrease in ventricular volume, and that is because the blood in the ventricles, now that that valve is open, is getting squeezed out and up into the aorta. And we can also see that reflected on the increase in aortic pressure, and that's because we are now filling that aorta with blood. Now our ventricular depolarization is going to be complete. We're going to get that last little bit of contraction. That last little bit of blood is going to leave the ventricles. And from there, the blood in the aorta, we're going to start to see that aortic pressure drop because it's going to be pushing blood out to the rest of the body. And we're also now going to see ventricular pressure start to drop because we are now no longer contracting. And this is because we are in that ventricular repolarization. Our heart is relaxing. We can see that right here on our T wave on our EKG. Now, once our ventricular pressure falls below our atrial pressure, what happens is our mitral valve opens. So during ventricular repolarization, when our ventricle is relaxing, our atriums are also now refilling with blood. So when that drop in ventricular pressure goes below our atrial pressure, we're going to open that mitral valve and passive filling is going to begin. And we know that passive filling is occurring because we see this increase in ventricular volume. Blood is going out of the atrias and is flowing in to the ventricles. Now, this occurs until our next cardiac cycle begins. So, now that we have a basis of relating all of these lines together, we have related the depolarization and contraction with the changes in pressure and volume in the heart. If this is for normal heart function, I'm sure everyone's wondering what happens if someone doesn't have normal heart function or they have pathologies that lead their heart to malfunction. And we're going to look at that next, specifically with one pathology, which is atherosclerosis. Sorry, I have a difficult time pronouncing that. Okay, so I think a good place to start is defining what atherosclerosis is. And what it is the buildup of plaque or the decrease in lumen diameter size. So basically, atherosclerosis can happen anywhere. It can happen in your periphery, and in that case, it would be called peripheral artery disease or peripheral artery disease. It can happen in your coronary arteries, which is what supplies your heart with blood, and in that case, it's called coronary artery disease. But like I said, main thing to note here, what it is it's just the decrease in lumen size due to a buildup of plaque in a blood vessel. So the first thing that we can talk about is how this is going to affect Wiggers. So if we decrease the lumen size of a blood vessel, what's going to happen is we're going to increase our blood pressure, because it's kind of the same as vasoconstricting, but there's a blockage here instead of actual vasoconstriction happening. Anyway, because of this blockage, less blood is going to be able to pass the blockage, so we're going to increase our blood pressure. Now, we know that systemic vascular resistance is a whole system, so if we increase our blood pressure, we can have a backup of pressure, which can increase our afterload. So what this is going to affect on Wiggers is our aortic pressure line. If we increase our afterload due to the backup of pressure caused by the atherosclerosis, we're going to shift this entire red line up. And what that means for heart function is when our ventricles contract, it's going to take longer for our ventricles contraction to build up enough pressure to beat our afterload. So this means that our aortic valve is going to open later because it's going to take longer to beat that afterload, and it's going to close much sooner. And what this then entails is we're going to have less blood leaving the heart, because if it takes longer for us to open this valve and then the valve closes sooner, there's going to be less blood getting ejected and more blood staying in the ventricles. So our ventricular volume here on this little purple or pink line, whatever you would like to call it, is going to shift up a little bit because less of that blood is going to be leaving. Now, another thing we're going to see, because we have ejected less or a lower amount of blood out of the heart, we're going to have less venous return, which means our passive fill is going to be affected. So this line right here is going to be lower because we're not going to be getting as much passive fill because we have less blood returning to the atrias, therefore less blood going into the ventricles. So now that we know how this affects our Wiggers diagram, we can talk about some treatments. So how we can try to get this back to normal as best as we can. So the main treatment for atherosclerosis to help bring Wiggers back to a normal state, or as close to as a normal state as possible, is going to be a drug which is called ACE inhibitors. So first, before we get into what ACE inhibitors do, we should probably talk about what ACE is in the body. And ACE is our angiotensin converting enzyme. I always forget if this has an O or not, so if that's spelled wrong, don't harp on me too much. But ACE stands for our angiotensin converting enzyme. And what our angiotensin converting enzyme does is it converts angiotensin 1 to angiotensin 2. And angiotensin 2, what it does in the body is it causes, let me get a different color marker here, it causes vasoconstriction, and it also causes sodium and water retention. So this is good. Angiotensin 2 would be very good for somebody who has low blood pressure, because we're going to be increasing the blood pressure, one, by decreasing lumen size. We're going to be vasoconstricting, so that's going to increase blood pressure, and two, if we are retaining sodium and water, that's going to increase our blood volume. So angiotensin 2, good for people with low blood pressure. But for people that have atherosclerosis, angiotensin 2 is not something we want, because the atherosclerosis is going to go ahead and increase our blood pressure, because that blockage is going to have a decrease in lumen size. So we don't want to vasoconstrict, and we definitely don't want to have higher blood volume, because that's just going to make the blood pressure shoot up even higher, making afterload even worse. So for people that have atherosclerosis, a treatment for them is ACE inhibitors. And ACE inhibitors, what they do is they basically just block angiotensin 1 from converting into angiotensin 2. So we don't get this vasoconstriction, and we don't get this sodium and water retention. So if we block the vasoconstriction, we block sodium and water retention, we can lower some of the blood pressure, which can help lower this aortic line a little bit more and help deal with afterload a little bit more. So basically, whole goal with ACE inhibitors is to lower blood pressure, and how that helps with atherosclerosis is because if we lower our blood pressure, we're in turn going to lower our afterload, which will help take care of part of the issue caused by atherosclerosis, which is high afterload. So there we go. One thing I will note though is if we don't have sodium and water retention, this can look a little bit different on Wiggers, because we're going to be decreasing our blood volume. So that is one thing to note, that our ventricular volume line might go down just a little bit there because we have a little bit less blood volume. But